Kia ora koutou. Welcome to our third live streaming session. This one is a focus on providers, but as with all of the other sessions, we welcome anybody else who's attending, including disabled people and whānau. So as you'll be aware, or most of you will be aware, there was an announcement last week that we're going ahead with the transformed system in Mid-Central region around Palmerston North. And so this is an opportunity for anybody to ask any questions that they have about the announcement and about what's going to happen from the 1st of October in Mid-Central. I'm actually filming this from Palmerston North today, and you'll see that I've got a New Zealand Sign Language interpreter alongside me. I might not be able to answer all the questions that you have, but if I can't, we'll try and make the information available on the website as soon as possible after this session. Also, we really welcome any feedback. So if you have feedback about the live streaming sessions, please contact us at stfeedback@moh.govt.nz. As I said, this is the first session. We did have a technical hiccup with the second session last night, so let's hope that everything goes smoothly today. So the first question I have was a question that was sent ahead of this session from the provider core group, and it was asking the question, what will the process be around connectors in terms of recruitment and training? Who will undertake this? So with connectors, there will be 3 types of connectors in the prototype. So there will be 18 connectors who are employed, and they will report into the Ministry of Health, and we will be starting to recruit from those roles from late May, early June. And we're expecting to get the connectors on board by the middle of August. They will report into a team that reports to the Ministry of Health, and in terms of the recruitment and training for them, the recruitment will be done by the Ministry of Health in partnership with some disabled people and whānau from the regional leadership group. And we'll be doing induction and training for all of the new roles in the system from the middle of August, and we will also be doing that in partnership with disabled people and whānau. Another question from the provider core group that they sent before, the date of the start of 1st of October 2018. What does this mean? Oh, sorry, actually, I'm just going to go back to the connector question because I talked about employed connectors. I didn't talk about the other 2 types of connectors, so I'll just go back and talk about that. So in the prototype, we're testing 3 types of connectors. So the employed ones, which I talked about, and the second group of connectors is that we will be having some contracts with some non-government organisations for connectors where there is specific expertise that we need outside of what we've got within the employed connectors, and that may be things like cultural experience and expertise. And we will be contracting with non-governmental organisations who do not provide any disability support services, because it is important that the connector role is independent from the provision of disability support services. So some of the areas where we may be looking for a particular cultural perspective is in terms of Māori or Pacific people, or working with the deaf community, which is also has a cultural perspective about how you deliver the support. The third option around connectors is that some disabled people in whānau may have someone in their lives that they think has all the skills to be a connector, and there will be a process for them to suggest that this person is their connector, and for us to work with them to ensure that they have the appropriate skills to be able to do that. So that will be the third thing we're trying in the prototype. So back to the second question that I had from the provider core group before this session. On the 1st of October, what does this mean? Is there a transition period from NAS to the new system? How will this work? So on the 1st of October, everybody in Mid-Central region will be in the new system. But what does that actually mean? Whatever support you are getting on the 30th of September will continue to be the support that you receive on the 1st of October. And if you want to make changes to that or look at other options, you can contact us in the new system, and we'll be communicating out to people long before the 1st of October the ways that you can contact us. and there will be the ability to come and talk to somebody face to face here in Palmerston North, but we will also have a physical presence 1 or 2 days a week in some of the other areas like Otaki, Levin, Dannevirke, Feilding. And there will be the ability to contact us by phone or by email. So you'll be able to say, look, you'd like to work with us, look at options to change, and you'd like access to a connector. Or when it comes to your regular review period, we'll be contacting people. But on the 1st of October, everybody who is new coming into the system will experience the new processes and system, and everybody who is in the system will be in the new system, but nothing will change for you unless you want it to. Welcome to all the new people. We've had lots of prepared questions, but please feel free to post them on the chat or email stfeedback@moh.govt.nz. We've had a question from the provider group about what will the accountability measures be in the new system. And I'm not entirely sure what they meant by that in terms of the question, but we are developing an outcomes framework for the new system, and what we will be doing is looking at what the different measures that will be measuring progress against. And obviously the purpose of this is to ensure that disabled people and whānau have more choices for support and greater decision making over their support in their lives. So that will be some of the things that we're looking at measuring. Other things we'll be looking at measuring is in terms of the experience of disabled people and whānau in the new system. What kinds of things are they doing with the support? Are they trying new things? What are the outcomes that they're achieving with their support? How are the different roles working in the new system? There will be a whole range of things that we're measuring, and there is currently an evaluation and monitoring working group that is looking at what we need to put into that measurement framework and in terms of what we need to look at in terms of monitoring and evaluation. There will be information from that working group going out for virtual testing in the next few weeks, and if you're interested in providing feedback on that, please contact us at stfeedback@moh.govt.nz. I think the other things that when people are talking about the accountability measures, there will also be measures set for the new roles in the system. So around the directors, around the different roles, and we will also be reporting against those at a high level and using those in terms of providing feedback to individuals within the system. I've also had a question from Lawrence about what is the process of becoming a new service provider coming on board. Now, I think that is one that we're looking at, that disabled people and whānau will be able to choose different options. So at this stage, we're not thinking there will be a particular process to register new service providers in any way, but what we will be looking is to, before the 1st of October, have information about what are the options for support and who are the providers in Mid-Central region, and having objective information available for disabled people and whānau to look at. But also that's the sort of information that will feed into induction and training for connectors and for other people in the system. So we will be going out to the community and asking for people to tell us where there are providers and what are the sorts of things that they can provide. But I think it's currently we probably think about disability support providers in terms of the people that the Ministry of Health contracts with or other government agencies, and there will be the potential for there to be a broader range of people, and for disabled people and whānau to contract directly with them or to purchase specific things using their personal budget. In saying that, I just want to really emphasise that not everybody will need to have a personal budget or have to manage the funding themselves if they don't want to. There'll be a range of options available for disabled people and whānau to choose, purchase support and to manage that, including things like having the funding in a bank account and being able to do it all yourself, including employing support workers, or using somebody in the community like an accountant, or going to a host provider, or using a flexible disability support contract with a provider, or going and contracting directly with a provider, or saying, actually, I want to work with this provider, but actually I don't want to be the one who manages the contract with them. So there'll be a whole range of options available to people about how they manage that money. Nikki has just asked, what about people who currently access a bulk funded service and their budget will not allow for this to continue as an individualised support under the new system? So in terms of the process, we're still working through exactly how the funding allocation process will work, and there is information out for virtual testing on that at the moment. And if you'd like to provide feedback, again, please contact us at stfeedback@moh.govt.nz and we can connect you into the virtual testing group on funding allocation. Or if that Lumio doesn't work for you, we can provide the information directly for you to provide feedback. In terms of the, going back to the bulk funded service, so we will continue to have the current supports that we purchase centrally will still continue to be available in that way, but also under the new funding process, we'll be working with people about what it is that they're wanting to achieve in their lives and what are the options to achieve that and what support is required to do that. And we'll be working through what are the options to create something that works for the disabled person and whānau, and they'll have an access to a connector with that. Specifically on the funding around community participation, we know that not everybody currently picks up that funding, picks up that particular service because it doesn't work for them, and there is some additional support in the Mid-Central prototype that allows for that. So for people who have looked at the information that came out with the announcements, there is an extra 6.485 million for direct support within the prototype. In addition to the previous question from Lawrence, he's asked us sort of follow up. Will the individual be able to have a mixture of funding for support? E.g., can the individual be supported by a service provider and the other half to be managed by the individual family to employ others for support? And absolutely, in terms of the options to manage your funding, you will be able to have a combination. So you might want to continue continue for the ministry to contract on your behalf of the provider, but you want some of the funding to be available for you to purchase things directly and have that in a bank account. So there can be a mixture of ways that you want to manage the money. Graham has just asked, I've heard unofficially that North Shore Auckland is possibly being proposed to roll out in 2020. Is this the current proposal yet to be confirmed? At this stage, no decision has been made about rollout post Mid-Central region. So what we do know is that we'll be providing advice to ministers about the next steps beyond Mid-Central region in late 2020, and no decisions have been made beyond that. In terms of our thinking about what potentially could happen, we have thought about a kind of three-phased approach beyond that, going to the regions that currently have demonstrations in place, followed by Auckland North, and then followed by the rest of the country, but no decisions have been made on that yet. Please keep asking questions via live streaming or email. I've got a question about, will ACC funding be included as available or treated separately? So we're working closely with ACC to look at where we have shared clients, so people who receive support from the disability support system and from ACC, how can we make that as seamless as possible? And we're still working through exactly what that would look like, But some of the things we're thinking about is where someone receives support from the disability support system and they have a short-term injury where they need additional support, like additional household management or more time with a support worker, that there would be the potential to put that into their current budget and to be able to use the same support workers. We're also looking at how can we streamline and give people one person to work with when it's not yet clear whether support will be provided via ACC or the disability support system. So that may be where it's potentially a treatment injury and it's not yet clear whether the person will receive support from the disability support system or ACC. So we're thinking about it would be good if the disabled person in whānau could work with Connecta and they manage the processes in the background across both. We have had a working group looking at the government interface and we've had feedback on that, and our next steps is just to work through and confirm that with ACC, and we will come back with more information about that before the end of June. The Mid Central Provider Core Group would like to know how many connectors will there be. So in terms of the proposal, at this stage we're going to employ 18 connectors across the region at the beginning of the prototype, and as I said, there will also be the potential to use connectors through contracts with non-governmental organisations who have particular expertise, particularly around where there might be cultural shortages, and also the ability to be able to use someone within your networks where they have the skills. That is based on international evidence has shown where connector type roles like local area coordinators have gone in, about a third of people have taken up that option. So in the prototype we've allowed for, we've based the numbers based on 40% of people wanting to work with the connector from the existing client group, and there also being enough capacity for people for an additional 10% to work in outreach, and also for the new clients that 80% of people will take that up. Now this is all part of the try, learn and adjust approach, and we don't know what will actually happen in practice. So this is one of the things we'll be looking at. Have we got enough connectors? I've got a question that came in earlier from Robin. What will System Transformation be doing to help providers between now and the rollout? So there's been a provider working group that has been looking at what kind of capability development and support will providers and the workforce need leading up to the 1st of October. And we've got some proposals going to the regional leadership group to make decisions on today. And so we hope to be able to give you more information about what we're going to put in place in terms of supporting providers up to the 1st of October and after that. But short answer to that is there is some funding available to develop the capability, but there will also be a lot of engagement with providers. So this is one of the types of engagement in terms of live streaming sessions. We're also planning to have forums, and we also know that we're working with providers to look at what support do they need to provide information to their workforce and staff. So we'll be working with provider umbrella groups, unions and providers to develop that over the next little while. We're really interested in people's views on what else would be helpful, so please send any feedback back to us on that at stfeedback@moh.govt.nz. Graham has just asked, can disabled people from Mid Central who opt to manage their personal budgets from 1st of October 2018 choose to receive services from providers outside the Mid Central region? Now that is a really interesting question and not one that I've come across before, and I think the answer probably is yes, they will be able to if the support can be provided within the Mid Central region. So there are some things where purchasing a thing is pretty easy to get from another place, but if it's ongoing support, that would be pretty difficult to be provided in the mid-central region. But we're trying to have as few rules as possible. So that is one that I will take away and make sure that we're thinking a bit more about. But we will try our best to have the fewest restrictions we can on that. Just had email from question from Elliot via our ST feedback that Sasha mentioned flexible disability support contracts for providers. Can you please expand on what providers will need to do to gain one of these? Okay, so we are currently working on what are the new types of contracts and what will be the procurement processes for those that we will need in the mid-central region. And there's kind of three types that we will be doing there. So one is having some immediate resourcing contracts. So this is some short-term support for disabled people in whānau, and we're looking at new types of contracts for that. Second one is around the contracts with non-governmental organisations for connectors. And the third one is about some of the contracts for the funding mechanisms, so ways that people can use their funding. And the flexible disability support contracts are in that group. So we expect to be able to give providers more information about what we will be seeking from the market and what the process will be for procurement before the end of May. I've also had a question, can you please expand on so this is relating to this, on what providers will need to do to gain one of these and what, if any, criteria there are likely to be. Will providers who already have these in Christchurch be able to be fast-tracked for Mid-Central if they operate in both areas? On that, as I said, we're still working through the process for that, and I probably can't answer that now, but we will make sure that that is part of the thinking that we're doing in terms of the procurement process and make sure that that's available in the information before the end of May. Had an email via Logan. How will you know whether the new system is working? So one of the things in terms of, we've got a whole kind of plan around evaluation and monitoring, but what we want to do is make it as open as possible for disabled people in whānau, providers, workforce, staff in the system to provide feedback about how things are going so that we can collect information about what's working and what's not working from day one. And we'll be, the kind of approach we're taking to the prototype is a try, learn, adjust. So we've been working with a co-design group and then with working groups to develop what it will look like on the 1st of October. We're going to try that and we're going to learn things that are working or not working as intended, and then we will take that to the regional leadership group and the regional governance group and make decisions on any changes that we're going to make to that. And to inform that, we'll be looking for feedback from everybody in the system. We will, in terms of the monitoring, we've also got a request for proposal out for baseline data gathering before the 1st of October, so we can understand how things are working now, so that we'll be able to go back and can compare how things are working under the new system. There will also be a series of measures that we're getting regular reporting on how things are going, and part of that will be the experience of disabled people in whānau in the system. We have time for a couple more questions, so please keep them coming. Though if you don't have your question answered in the next few minutes, please email us at stfeedback and we can respond to you directly or also ask it for the next session. I've got a question from Araha via email. Is it likely that individual funding for disabled people will be reduced as a result of this new system? In the new system, we are putting in additional funding for the prototype. So all of the funding that is currently in the system will be there, plus an additional 6.45 million. So we are looking that across the whole system, there will be additional funding for support and not a reduction in funding. Just waiting. Okay, I've got a question, but I've actually talked about that in terms of provider capability. So I don't think I've got anything to add to that there was funding put aside for providers, and we've got some proposals going to the regional leadership group today on that, and we hope to be able to communicate out to everybody very soon about what will be happening in the Mid-Central region. So just 5 more minutes for questions. Keep them coming. Graham, thanks. This will be posted on the website post the session. Thanks for the question, Graham. So I'll just go back to that again and say Provider Capability Fund. So Graham might have missed there is some money put aside. The idea, so there's been, we've had a provider working group that's put through some ideas, and we're going to the regional leadership group with some proposals around what to use that capability fund for, and we expect there to be some decisions about how we would use that up to the 1st of October and post that. So we'll let you know as soon as we have decisions on that. It's gone nice quiet. People have run out of questions for me. Got a few more minutes. Probably the thing that hasn't been asked directly, but I know providers are really interested in, is when will we know about our contracts? So we're working through the contracts at the moment and looking at, firstly looking from the kind of question about what makes sense to put it into personal budgets versus what makes sense to continue to purchase centrally. And the kind of decision making that we're taking out through when we're thinking about that is something a specialist disability support. And then the next question is, are there benefits from putting it, from people purchasing it individually through a personal budget, or are there reasons why we would want to continue to purchase it centrally? And there are kind of 2 main times when we think it would make sense to purchase centrally. And that is for things where there are benefits from purchasing in bulk. For example, equipment, where a disabled person and family purchasing individually may not have the same ability to negotiate a good price. So that's one area. And I'm not saying that would be for all equipment, just for some equipment. And the second area is where there may be situations where if the government doesn't contract centrally, that support may not be available. And so that might be things for where people have challenging behaviours and there is a high level of specialist support required. So we're looking at the kind of situations where we still need to make sure that there is support available to people. So we're working through that and having a look at that. We're going through, as I said, there's areas where we're developing new contracts, and then we'll also be looking at what are the implications for the existing contracts, and we expect to be able to get back to providers on that before the end of May. What we're trying to do is streamline the contracts and to take away some of the restrictions, make them more outcomes based, but we also want to make sure that we're balancing the kind of requirements for additional information or for providers. So there will be managing that, and in particular where people have national contracts, trying to make it as easy as possible for everybody to understand what is different in Mid-Central and what are the requirements for that. So we will come back to providers and make that information available about what will be happening with contracts, processes and timeframes before the end of May. I've got one question, Tania, via email. If you have an MSD contract for vocational community participation, will you also be able to charge a fee for service to those who opt for personal budgets? So, yes, there will be the ability for disabled people in whānau to negotiate directly with a provider, but that doesn't mean that the provider would be able to charge the disabled person and family and have a contract. It would be an either or situation. But on that too, in the question about MSD contracts, we are still working through what funding will come in through from other government agencies, and we will be taking recommendations to government about that at the end of June. So that is looking at what funding from across government should come into the new disability support system. Thanks to everybody who has asked questions. We will post this and it will be available. Thanks to the New Zealand Sign Language interpreter, and please let us know about whether this has worked for you and whether you would like more sessions, and also whether you'd like specific sessions targeted to different types of providers. Thanks very much.